Hello, my name is Tatiana Palukchi. I am Assistant of Infection Diseases and Dermatovenerology Department, South Kazakhstan Medical Academy. First lecture about introduction to the specialty, structure of infection diseases service. Infection diseases are defined as disorders caused by organisms such as bacteria, viruses, fungi, or parasites, which can be passed from person to person. Some are transmitted by insect or animal bites, while others are passed by injection contaminated food or water, or being exposed to organisms in environment. Infections is the enlargement and multiplication of organisms in the tissue of host. Here in this slide you can see biofilms of different types of bacteria. Nowadays exists classification of infection agents. It may be bacteria, like gram-negative or gram-positive. Big group viruses, which may be separated into types DNA viruses or RNA viruses. For structure, it will be separated in enveloped and non-enveloped. Fungi may be disseminated or localized form. Parasites include protozoa or helminths. And prion, virus, plasmid also include in classification of infection agents. Initial infection with organism in host is named primary infection. Subsequent infection by same organism in the host may named like reinfection. This process will be after recovery. Infection by same organism in the host before recovery means superinfection. And when in host whose resistance in lowered by pre-existing infection diseases, a new organism may set up in infection, it's named secondary infection. In condition where due to infection at localized site like appendix and tonsils, general effects are produced, named focal infection. When a patient suffering from a disease and new infection is set up from another host to external source, it's named cross-infection. Cross-infection occurring in hospital, named nosocomial infection. And one where clinical effects are not apparent, named subclinical infection. Man in itself a common source of infection from a patient or carrier. Healthy carrier is person harboring pathogenic organism without causing any disease to him. A convalescent carrier is one who has recovered from diseases but continues to harbor the pathogen in his body. All this infection named anthraponosis. Infection diseases transmitted from animal to man are called zoonosis, and zoonosis may be bacterial, like plague from rat. The diseases caused by insect are called arthropod-borne diseases. Infection like mosquitoes, flea, lice that transmit infection are called vector. Water may be source of infection. Bacteria like Vibrio cholera, infective hepatitis viruses may be found in water. Contaminated food may be source of infection, and presence of pathogen in food may be due to external contamination like food poisoning by Staphylococcus. Spores of tetanus bacilli, gas green infection remain viable in soil for a long time. Epidemic diseases are ones that are constantly present in particular area. Typhoid fever is endemic in most parts of India and in other countries. An epidemic disease is one that spread rapidly, involving many persons in area at the same time. Influenza causes annual winter epidemics in cold countries. Pandemic, it is epidemics that spread through many areas in the world, involving very large numbers of persons within a short period. For example, it will be influenza, cholera, or plague. Epidemics vary in rapidity of spread, and waterborne diseases such as cholera and hepatitis may cause explosive outbreaks, while diseases which spread by person-to-person contact envelop more slowly. Infection may be transmitted by direct contact, which include ways like person-to-person, animal-to-person, or from mother to unborn child. Next way, it is indirect contact. It is mean touching infected inanimate objects than yourself without thoroughly washing. In infection diseases present some routes of transmission. First, it is inhalation, ingestion, contact, sexual transmission, insect, animal bites, injection, or vertical transmission. All infection diseases has some stages. First stage, it is incubation period. What does it mean? It is time between infection and the appearance of signs and symptoms. So here we not see any symptoms. Next stages, it is prodromal period. It is mild, non-specific symptoms that sign onset of some diseases. Mild and generalized symptoms appear in patients like fever, weakness, headache. Clinical phase means a person experienced typical signs and symptoms of disease. And last stages mean recovery phase, when symptoms has disappeared and tissue heal and the body regains strength. How do we stop it? So any diseases have different mode of transmission. For example, kissing, sexual contact, skin-to-skin contact, named direct contact. And infection like skin infection, scabies, may spread by direct contact. Organism or large respiratory droplets that people sneezing, coughing, drip, or exhale. Diseases spread when people are close to each other, usually less 3 feet, and inhale droplets. These route named droplet. And diseases like mumps, pertussis, meningitis may spread by droplet route. Contact with contaminated surface clothing named indirect contact. So all skin infection, diarrheal diseases may spread by indirect contact. Bite from diseases carrying ticks, fleas, mosquitoes may spread by vector route. So, for example, it is Lyme diseases or La Crosse encephalitis. Next route, it is eating, drink contaminated food or beverage, transfuse infection, blood, vomitus. All this route named vehicle. And some diarrheal diseases or hepatitis may be spread by this route. Organism on dust particles or small respiratory droplets that may become aerosol when people sneezing, coughing, laughing, or exhale, it is named airborne route. So chickenpox, tuberculosis, smallpox, anthrax may spread by airborne route. And how we do infection control? For example, all infection which way and road is direct contact, we should use of barrier. For example, condom, protective clothing, dressing. And all infection by which spreading by droplet, we should to do some respiratory etiquette. Infection which spreading by indirect contact, we should to do some hand hygiene, sanitizing infection surface. And infection which may be spread by vector way, we should to do vector control. For vehicle route, we do some proper hygiene and sanitation, or we do some cooking food or boiled water. And all infection which spreading by airborne, we should to teach patients do some respiratory etiquette or do isolation this kind of patients if it necessary. Thank you for attention.